Hello, and this is Belinda. I'm going to have a little chat to you today about Assessment Task 2 for CNA 345. So this case study that we're asking you to do is going to focus on the discharge planning for Lars de Jong. So he's been seen by his psychiatry team and he's been seen by his physician and he's cleared to go home. There are two key components that you need to consider in his discharge planning. One of them is that Lars is not willing to go into respite or into residential care. So take that off the table. The other thing that you need to consider is that when looking at the services that you want to select to help you in providing that nice clear boundaries for you, Lars lives 2 blocks over from your house. So that just provides a bit of a context for you. So when we start looking through the rubric, criteria 1 aims to establish goals and select a course of action for discharge using the principles of strength-based nursing. So in this criteria, we're looking at how you're going to be working with Lars and the de Jong family to identify what they do really, really well and where they need their support. So you need to identify goals for discharge that are appropriate for Lars and the family, taking into consideration their situation. You then need to, from those goals, go, okay, what does Lars need to successfully go home? What supports does he need and what services are going to provide those supports? So this is where you can use tables and graphs or appendixes to save a bit on your word count, because identifying these services can be quite substantial. Now you do need to link these services back to Lars. How are they going to provide the most appropriate service for Lars, and also be very specific about what services they're going to incorporate. So now we move on to criteria 2 of the rubric, which looks at the legal and ethical principles involved in the decision making, communication, and the importance of shared decision making. So when we start looking at some of the ethical principles involved, you might want to reflect back to CNA 153, your Foundations of Professional Practice 2, where you talked about autonomy, beneficence, paternalism, advocacy, and you need to link these ethical principles into the shared decision-making process. Legal considerations that you might want to review would be the right to self-disclosure and the risk of harm to others or yourself, and maybe a little look at consent would be appropriate for Lars. Criteria 3 looks at the culturally safe care development aspect of your plan. Now, when we look at Lars and his family, Lars wasn't born in Australia, so he's an immigrant. Have a discussion about how this impacts on the development of a culturally safe care plan for Lars and his family on discharge. What considerations and services do you need to incorporate into his plan because he's an immigrant and because of these cultural differences him and his wife have compared to an Australian-born family? Criteria 4 is your academic writing and Harvard referencing, and again we are looking for a high level of planning, well-constructed sentences, and solid referencing. So I just want to offer you the opportunity to review strength-based nursing and shared transfer of care principles. So we'll start with strength-based nursing, which is a philosophy and value-driven approach to nursing that guides clinicians, that is based around patient-centered care, empowerment, relational care, and innate health and healing. I personally find that very big and confusing, so I needed to break it down a little bit. So we'll start with health and healing, which is about wholeness, and then we need to still break those down a little bit further with health, looking at the patient's abilities to develop capacities, capabilities, and skills to maximize functioning, adaptability, flexibility in response to challenges. And when we're looking at challenges, we're looking at both physical, emotional, mental, and spiritual challenges for our patient. Healing is defined as an ability to repair, renew, restore, and arrive at a whole new level of wholeness. Again, wholeness looks at more than just a broken leg healing, and it can be that emotional, mental, and spiritual wholeness. When considering a patient's journey towards the health and healing, we need to recognise that it's influenced by a number of factors. Primarily, it is influenced by the uniqueness of the patient. This is who and what they are and what they strive to be. So we're looking at their individuality. We also need to understand that our patients live within an environment. Now, I know you're all sitting there going, well, we all live within a physical environment, but there is a lot more to our environment when we're looking at our patients to consider. We need to also look at their social and cultural context. Both of these factors, the patient's uniqueness and their environment, physical, cultural, social, influence and are influenced by the patient's subjective reality. Now I can hear you all rolling your eyes at me and having nervous flashbacks to philosophy in first year, but just give me a moment. When we're considering a patient's reality, we are recognising that everyone makes sense of and understands and explains reality in different ways. Perfect example is, have you ever sat down to discuss a book or a movie or a practical lab with one of your friends and they've grasped this deep meaning and understanding and this symbolism and it was amazing and wonderful, and you're sitting there going, yeah, not sure we were in the same place on that one. That's the different ways we experience our world. Why is this important to discharge planning though? As a nurse, when I discharge a patient who's come in with a dislocated shoulder, we've given them a bit of propofol, pop that shoulder back in, great, wonderful, we fix them. I then tell my patient that they need to go home and rest for the next 3 weeks. They're not going to be moving their arm out of their sling other than doing their elbow exercises. They're not allowed to drive. And when they do go back to work, they're going to be back on light duties and seeing a physio once to twice a week over the next 2 months. Pretty simple discharge plan. Now, the majority of dislocated shoulders that I look after are young males. This could be a bit more difficult. Let's make our patient a father, a new father, who's casually employed in a manual job and is his sole income. His bub's 4 weeks old, and due to the couple's last financial year income, they're not going to get any parenting payments for a little bit. It's going to be a bit delayed for the next 4 weeks. And they live 15 minutes out of town, and his partner doesn't drive. She's got epilepsy. So taking this into consideration, how capable is he going to be to take 3 weeks off work? Well, we as nurses and healthcare professionals understand that for him to minimise the risk of having another dislocation of his shoulder, he needs to rest and take the time off work. His priority is maintaining employment and looking after his family and providing food and shelter. So that means he needs to work. This thought then leads into consideration for the patient's readiness for learning and self-determination. As healthcare professionals, we need to respect our patient's ability to choose and control and take charge when decisions are being made. Part of our role, though, in that decision-making process is to support the patient's learning by understanding their uniqueness and tailoring education to support their learning. What does this mean? This means I need to tell him, well, I understand that you need to go back to work, but when you do that, you need to understand you're putting yourself at a higher risk of dislocating your shoulder again and therefore taking more time off work. We need to be careful though in these interactions, because as nurses we intrinsically have power over our patients. We are the professionals with the knowledge, the expertise. To effectively collaborate with our patients, we are required to consciously consider the patient as a whole so that we can support our patients rather than disempowering them. So now that we've identified the patient's priorities of work, income, transportation, and looking after his family, we also need to consider his medical priorities, which will be pain management, specialist follow-up, and a fitness for return to work. So to achieve these, as a discharge nurse in a hospital, I can't do this. So I need to incorporate other services. Some of the people that I'll need to incorporate into this patient's discharge plan is his GP, the community health centre. Most people that live 15 minutes out of town are close to a community health centre who will have a visiting physio who could attend once a week. I'll also need to incorporate a social worker and ensure that his discharging doctor has considered his specialist referrals. Now, we're incorporating all these other services. We need to communicate with them what our patient's priorities are, both for himself and medically. So his GP is going to need a discharge letter outlining what we've done for the patient and why he needs to be followed up and what the plan is from there, so his follow-up with his specialist appointment. The patient is going to need a referral, and it's usually a medical referral to a physio and a community healthcare centre. We're going to need to make a phone call to the social worker and the social services to get them involved in his care. They may not be able to see him before he's discharged, but they will be able to contact him within the next 24 hours. We also need to refer him to an orthopaedic surgeon to continue care and to review if he needs surgery at a later date. How is this all going to happen? Now, the majority of the time we will use written tools. Now, they are available on Milo as a link. So we can use our written tools, we can use our written discharge paperwork. We'll also use electronic communications. In the age of now My Health Record, this can be communicated quite clearly so that a referral can be sent, and then the referring specialist can actually review My Health Record to see what's happened for that patient and where they're at. We can look at faxing to GPs to ensure that the electronic transfer may not have gone through, so we can fax it as well. We also need to look at medical certificates and ensuring that our patient has all of the contact details for all of those specialist services that we've referred him to. So he's going to need to ensure he's actually got his GP's phone number. He's a young male. He might say he goes to this particular clinic, but you know, he goes once every 5 years. He hasn't actually been there, that just happened to be the closest one, so he might actually need to get their phone number. We need to ensure he has the phone and contact details for the community health centre if he needs to change his physio appointment. He needs the contact details for the social worker. If for some reason he misses their phone call, how is he going to return it? It comes up as a blocked number. He's also going to need the contact details for the specialist that we're referring to him to, so that if he hasn't heard anything in 3 months, he can actually give them a call and say, did you get that referral? Now, he's also going to need hard copies of all of these referrals so that when he does call that specialist in 3 months, he can say, well, I actually have the referral, I can send it to you. He can send a copy of that referral through to the specialist and get all the follow-up that he needs. Now, if you've got any questions about any of this, please don't hesitate to pop them up on the discussion boards or to email me. I will be checking in over the Christmas New Year period. Enjoy your holidays, and we'll see you in the new year.